G'day everyone, I'll just turn my camera on briefly just to introduce myself and then we'll get straight into the presentation. So my name is Ben, I'm a vet with the Northern Australia Coordination Network as a part of the Department of Agriculture and Fisheries. I'm based in Cairns in far north Queensland and I'm the Queensland coordinator of the Northern Australia Coordination Network. So today we're going to talk a little bit about what the Northern Australia Coordination Network is, some of our key activities and things that you can perhaps be involved with. And then we'll talk a bit about Australia's priority emergency animal diseases and then finish a little bit with some discussion around the importance of biosecurity property planning. So the Northern Australia Coordination Network, or NACN, is an initiative that brings together the Northern Territory, Queensland, Western Australia and Commonwealth governments in partnership with key industries and local communities. Our purpose is to enhance biosecurity and emergency animal disease preparedness across the north to help mitigate the risk of emergency animal disease incursions. Our initial focus is on priority EADs, foot and mouth disease and lumpy skin disease. Our industry partners include AgForce, James Cook University, the Northern Territory Cattlemen's Association and the Kimberley-Pilbara Cattlemen's Association. By working collaboratively across the organisations and jurisdictions, we are increasing our capacity and capability across Northern Australia, where resources for biosecurity are limited. Our goal is to create long-standing relationships that continue to build our industry and community resilience across the north. So NACN's core activities include training and awareness, surveillance and early detection, and biosecurity property planning. These activities supplement existing national strategies to strengthen Australia's preparedness for potential emergency animal disease incursions. So our training and awareness activities are structured into 3 levels. Our level 1 training is what we call foundational EAD knowledge. And the key messaging there is what our priority EADs are, how do you detect and report them, and the importance of early detection. Our level 2 training is industry biosecurity response readiness training, and that higher level of training is targeted at people that are more experienced within the industry or have had that level 1 awareness training and have an appetite for more knowledge. And it aims to deliver some information about how emergency animal disease responses are activated at state and territory and national levels, the role peak bodies play in the event of an EAD response, the potential impacts of an EAD response for our industry, and how industry representative bodies can prepare for their role in a biosecurity response. The third and highest level of training is called Liaison Livestock Industry Training, and that's delivered by Animal Health Australia. So LLI training targets livestock industry leaders whom represent their peak industry bodies and can participate as an LLI in an EAD response. So you'd be responsible for liaising and consulting with the affected jurisdiction via the incident management team on response management and strategies. You also contribute to industry specific advice to assist the planning and conduction of response operations. So our level 1 and 2 training is delivered across the northern jurisdictions by the NACN industry liaison officers, as well as the state government officers. And as stated, the LLI training is delivered by Animal Health Australia. So communication engagement is a really important part of our project. You may have heard the phrase biosecurity is everybody's business, which highlights the important role we all play in protecting our native flora and fauna, the economy, and more specifically, our livestock industry. NACN have a priority focus not only to upskill and educate our livestock and associated industries, but also to engage with non-traditional stakeholders across the north. By bringing awareness to the greater public about the importance of good biosecurity behaviours and the risks EADs pose, we're increasing our passive surveillance network and embedding an understanding of how and why we are all responsible for protecting our livestock industry. NACN will be engaging with stakeholders in a variety of means, which includes promotional materials such as informative posters, info guides and magnets. As you can see on the slide here, there's a couple of examples of some of the magnets that we have created and distributed for foot and mouth disease and lumpy skin disease general awareness. If these are the types of materials that you think would be useful in your locality that you could share or distribute, or even as just general information for some of your staff, please get in contact with us and we're more than happy to distribute these to you. So I just want to talk about some of our key activities for the next 12 months. NACN represents a network of skilled and experienced government and industry personnel, and we're trying to utilise this to enhance our emergency animal disease preparedness with a variety of different activities addressing different areas of the industry. So Exercise Raintree is a mock LSD response exercise which aims to test the preparedness and response capabilities of the government and livestock associated industries of Northern Australia for an EAD incursion. So the exercise will be scenario based, involving all 3 northern jurisdictions, and one of the key outcomes is to complete an after action review to help inform our ongoing government and industry preparedness efforts. The Innovative Surveillance Solutions Workshop is an event we'll be hosting in Cairns to help identify new solutions for EAD surveillance in Northern Australia. The workshop attendees will comprise innovative thinkers from within the livestock industry as well as non-agricultural sectors. This is an opportunity for us to review our existing EAD surveillance systems, learn about current projects working within this space, and brainstorm some novel ideas. The Northern Australia Industry Leaders Network is a livestock leadership network that will be coordinated by AgForce's NACN Industry Liaison Officer, Roger DeSaley. So the NAIL network connects leaders from the Northern Australia livestock industry to share their knowledge and experience, drive industry progress, and initiatives such as this are fundamental in building relationships during peace, not war, to help develop our industry resilience. And then one of our last key activities is supporting NABSnet. So NABSnet is a well-established government program that promotes significant disease investigations in livestock of Northern Australia. So SDIs are an important part of our northern biosecurity as it improves our capacity for early detection of disease and to provide proof of livestock health status for market access. So we are supporting the NABSnet program with some funding to help promote participation in SDIs by veterinarians and livestock owners. So having heard about some of our activities and what we are doing, if you're interested in organising or attending a NACN training event in your locality, or you'd like some of the communication and engagement resources to display or share, or have any other questions about the NACN project, please just reach out via email and we can progress these things further. So in this next section of the presentation, we're going to talk about the priority emergency animal diseases with a particular focus on Northern Australia and the northern livestock industry. So Northern Australia presents a unique and challenging landscape when it comes to biosecurity, and it's considered a significant risk pathway for EAD incursions. There's numerous factors contributing to this. Some of those are listed here. So climate change, the presence of transboundary EADs in neighbouring countries, the expansive and remote distribution of livestock and wild animal populations, shifts in agricultural production and land use, limited and remote distribution of community members, pressure on our workforce, and travel and trade as well. So you can see in those 2 images there, the top being the foot and mouth disease global status as of July and August in 2023, and then the same for lumpy skin disease in 2023 also. And you can see, whilst distribution is global, there's a particular concentration in that Indo-Pacific region, which is close to the Northern Australia interface. So why are we so threatened by EADs? The impact of an EAD incursion will be felt immediately within the livestock sector, but the flow-on effects are widespread with long-term consequences. The direct effect to Northern Australia's major livestock industries would stem from export and potential domestic market closures. But in addition to this, there'd be disruptions to our production system associated with disease response activities, for example, movement restrictions. So individual producers may lose their livelihood. There's going to be animal welfare concerns for affected animal populations, environmental impacts affecting wildlife, environmental contamination and land pollution from our destruction and disposal activities. Rural and regional communities relying on the livestock industry may be debilitated, and there'll be social impacts affecting mental health, ruining associated industries such as transport, retail, stock feed companies, and disruptions to social and sporting events, and a hindrance to tourism as well. Supply chain disruptions would impact food supply for significant periods of time, and the national economic loss of a large-scale foot and mouth disease outbreak is estimated to be $80 billion over 10 years, which is obviously very significant to our national economy. So this slide here represents the top 10 emergency animal disease threats and some of the impacts they may have to either the national or state economy. Of those listed here, foot and mouth disease and lumpy skin disease are the most significant to Northern Australia and our livestock industry, and that's what I want to focus on today. So foot and mouth disease, FMD is a highly contagious viral infection. It affects cloven hooved animals, so that's cattle, sheep, pigs and goats, camels, deer and buffalo. The virus is capable of rapid spread between these species by direct contact with infected animals, wind dispersal, or contact with contaminated items. So when we talk about wind dispersal, if there's virus excreted into the environment with suitable environmental conditions, that virus can remain live and then spread via wind currents to other susceptible animal species within certain vicinities. Contact with infected animals is obviously direct contact between animals from one infected to another susceptible animal. Contact with contaminated items means it could be personnel or equipment that have come in contact with an infected animal that then spread that virus to susceptible animals mechanically. So FMD is most efficiently spread by the movement of live and infected animals. That's the most efficient means that it will spread through our naive population. And this signifies the importance of early disease detection and reporting, and why a national livestock standstill is imposed immediately in an FMD response to help limit that spread. So foot and mouth disease is present in Africa, the Middle East and Asia, as well as limited areas of South America. As of 2022, it was declared endemic in Indonesia. An outbreak of foot and mouth disease in Australia is most likely to be caused by feeding illegally imported food products contaminated with the virus, such as cured meats, to pigs. So pigs are what we call an amplifier species. So they secrete large amounts of the virus. So hypothetically, if someone were to illegally import a food product that is contaminated with the virus from a country where FMD is endemic, then they feed that to a pig. That pig becomes infected, excretes large amounts of the virus that then spreads to other susceptible species. This is one reason why swill feeding is illegal in Australia. So swill feeding is the feeding of restricted animal matter to livestock. So it's really, really important that you abide by the laws in not feeding restricted feed to livestock species. The virus could also be introduced if contaminated items such as footwear were to come in contact with susceptible animals. And this is why good hygiene practices such as clean footwear and clothing when traveling from FMD prevalent countries such as Indonesia is an important biosecurity measure to help keep Australia free of FMD. The Australian government recommends returning travellers avoid contact with livestock for 7 days upon return to Australia. It's really important to note foot and mouth disease, whilst it can be infectious to humans in rare instances, it is not a significant health concern and it's not a public health threat. It cannot be transmitted to humans through consumption of contaminated food products. So when we are concerned about an FMD outbreak in Australia, it is from an animal health perspective, not a public human health perspective. So how do we detect foot and mouth disease? Well, foot and mouth disease is a high morbidity, low mortality disease. What this means is that lots of animals would be affected with low numbers of deaths of adult stock. Higher rates of deaths of up to 50% can occur in younger animal populations such as calves, but in an animal herd of adult stock, you're going to have multiple animals affected with only low numbers of deaths. So given Australia's national herd is naive to foot and mouth disease and we have no immunity, our animals are highly susceptible to infection. So some of the common signs of the disease include dullness, reduced appetite, fever, profuse salivation, nasal discharge, lameness or reluctance to walk. And in animals that produce milk, such as dairy cattle, you're going to get a significantly reduced milk yield. So animals can develop fluid-filled blisters, what we call vesicles, of the mouth, the tongue, cheeks, gums, lips, and between the claws of the feet and above the hooves. So the key is in the name, foot and mouth disease. The areas of the body that are most significantly affected and we're going to see obvious clinical signs is around the mouth and oral cavity and around the feet as well. Ruptured blisters can leave open and painful sores. So depending on the timeline of disease and when you examine an animal, you may not see blisters. You may actually just see areas of the body that have red, painful ulcers. Clinical signs can also vary between species. So for example, in sheep and goats, the disease is usually a lot milder and they may not exhibit overt clinical signs like what we see in cattle. This is why we call cattle indicator species. So in a population of cattle, there will be very significant rates of morbidity or disease expression in those animals. And that's why if FMD is present in Australia, when it gets into cattle populations, we will see significant clinical signs. If you were to see any of the described clinical signs in multiple animals, you need to report this to a vet immediately. So what is Australia's response to a foot and mouth disease incursion? Our policy is to eradicate the disease and re-establish the FMD-free status of Australia. The aim would be to achieve this in the shortest possible time whilst minimising social, animal welfare, environmental and economic impacts. And one of the most important factors to minimise the impacts of an FMD incursion and support rapid eradication is early disease detection and reporting. This is why removing any negative stigma associated with being the first to report signs of FMD is crucial to protecting our industry. If foot and mouth disease is strongly suspected, there'll be a rapid lab confirmation and diagnosis before an immediate national livestock standstill. The national livestock standstill is critical to help prevent the spread of disease and limit industry impacts. So you just have a look at that image there that was taken in June of 2022. So this represents cattle movements to and from sale yards on a Tuesday and Wednesday in Queensland. You can see that more than 15,000 cattle have been moved both within the state and out of state as well, which signifies the importance for us to be able to trace the disease and stop the spread to have that national livestock standstill. So to eradicate the disease, destruction and biosecure disposal of infected and susceptible animals on infected premises is completed as soon as possible. So we call this stamping out. Additional measures may be taken if authorities deem it to be beneficial in containing and managing the outbreak. So these would include potentially emergency vaccination to reduce the susceptibility of animals to infection and clinical disease and potentially reduce the amount of virus they excrete, as well as the potential for preemptive destruction of susceptible animals to minimise the spread of infection. In Australia, foot and mouth disease is included as a Category 2 emergency animal disease in the government and livestock industry cost sharing deed. That's what we call the EADs. So when cost sharing of the eligible response costs of an incidence is agreed, costs are shared 80% by government and 20% by industry. Affected properties would have a valuation and compensation for animals that have died or been euthanized, as well as any of their property that's been destroyed for disease control purposes. After a successful eradication, Australia needs to demonstrate our proof of freedom status to the World Organization for Animal Health through submission of a formal report. This is important so Australia is once again recognised by the World Trade Organization as FMD-free for trade purposes. So what about lumpy skin disease? Lumpy skin disease is another highly infectious viral disease, but it only affects cattle, buffalo, and camels, and it's transmitted by biting insects. So LSD is prevalent in numerous countries worldwide, but most significant to Australia is its presence in neighbouring countries of the Indo-Pacific region, such as Indonesia. The most likely route for introduction of LSD into Australia is the entry of insect vectors carrying the virus into Northern Australia. So, for example, long-distance wind dispersal of biting insects from neighbouring countries to the north. So if a country north of Australia has the disease present and they have insects actively carrying the disease, those insects get caught in wind currents, come across the seas, introduced into Australia, they can then bite one of our susceptible animals, transmit the disease, and that is how the disease is potentially introduced. Insect vectors capable of transmitting the disease in Australia are also present. So once the disease, if it were to be introduced, can then be spread throughout our population of susceptible animals. And due to the complexities of managing insect vectors and the extensive grazing of cattle and buffalo across northern Australia, disease spread may be very difficult to rapidly identify and control. The virus is also stable in the environment, especially in cool shaded areas. This is particularly important for production systems such as feedlots, as the virus may survive in stock feed and supplements. This is also a potential risk pathway for disease introduction because contaminated fomites, such as animal hides or equipment, introduced into the country can be a source of disease spread as well. This, however, is low, very, very low risk in Australia because we have very rigid biosecurity systems that regulate the introduction of such products to Australia. Once again, it's very important to note lumpy skin disease cannot infect humans and does not pose a food safety concern through consumption of food products derived from exposed animals. So when we're concerned about a LSD introduction to Australia, it's once again from an animal health perspective, not a public health concern for human health. So signs of lumpy skin disease in cattle can range from inapparent to severe, which means some infected animals don't actually exhibit outward signs of disease. This is what we call subclinical animals. So an animal may have the infection and is capable of being a source of infection to other animals. However, they're not exhibiting obvious outward signs of disease. Mortality rates of up to 75% have been reported, but 1 to 5% is much more common. So we can expect, large numbers of animals to be affected. Not all of them may exhibit signs of this, but it would be expected that only low numbers within a herd would actually die from the disease. Common clinical signs include fever and depression, multiple skin nodules that are painful, watery eyes, loss of appetite, reluctance to move, swelling of the limbs, brisket and genitals. There can be reproduction losses and a reduced milk production. So the skin nodules may cover the whole body and appear as 5 to 50 millimeter diameter round, raised, firm lumps. And common sites for these are the head and neck, rear thighs, genitals, udder, and limbs. The nodules gradually become necrotic or rotten and can slough off, leaving holes in the skin, or potentially large areas of skin may also slough off, leaving a large bare patch of ulcerated skin. The skin lesions can persist for 4 to 6 weeks, and final resolution may take 2 to 6 months. So once again, if you were to see any of the described clinical signs in multiple animals, report this to a vet immediately. So what is Australia's response to an LSD incursion? Our response strategy, like FMD, is to eradicate the disease in the shortest possible time, whilst minimizing social, economic, animal welfare and environmental impacts. Eradication would involve stamping out with or without vaccination, depending on response-specific details, such as size and location. So responding to an LSD incursion in parts of Northern Australia with significant numbers of feral cattle and buffalo in difficult to access areas would be extremely challenging. So as an example of that, think about trying to administer vaccinations as a part of response activities to wild buffalo during the northern wet season in remote areas. There's obviously significant logistical difficulties associated with that activity. An LSD response does not trigger a national livestock standstill, but there would be strict quarantine and movement controls over animals and animal-related products, including, in addition to equipment and items that are potential sources of disease spread. Now, an LSD incursion is likely to involve an extended disease response and surveillance to establish proof of freedom. Disease response activities in naive countries trying to eradicate the disease have lasted for many years. Where it isn't possible to achieve disease freedom for the entire country, establishing and maintaining disease-free subpopulations through zoning and/or compartmentalisation may be considered to support resumption of market access. In Australia, lumpy skin disease is a Category 3 disease in the ADRA, which means costs would be shared 50% by government and 50% by industry. To attain proof of freedom, Australia will need to provide detailed information demonstrating our surveillance and examination has been adequate, quarantine movement controls have been maintained, and that the virus is not present within insect populations. Under the World Organization for Animal Health provisions, the earliest time to claim freedom from LSD is 14 months after euthanasia of the last case or last vaccination. So this slide just demonstrates some of the different phases of an emergency animal disease response. If you'd like to learn more about the detailed activities involved in an EAD response, I'd recommend completing the EAD Foundation course by Animal Health Australia. This is a free online course that can be accessed by anyone on the Animal Health Australia website. Additionally, Biosecurity Queensland has 2 upcoming free half-day events for industry biosecurity response readiness training. These workshops provide a foundational understanding of how a biosecurity incident will affect peak bodies operationally and is suitable for all staff and elected officials, not just those directly involved in response and preparedness activities. So on June 12th, we have an online session that can be accessed remotely, or otherwise those within the Brisbane locality can attend one face-to-face on June the 13th. So if you'd like to register for that, please contact Cameron Durnsford from the Department of Agriculture and Fisheries. You'll see his email there. Additionally, reach out to Greg after this webinar if you don't have those details, and we can forward them on. And Cameron can help you with the signing up process. Okay, so the last section of the presentation today, we're going to talk about biosecurity property planning. So having just discussed the potential impacts emergency animal diseases can have on Australia, it emphasises the importance of comprehensive emergency animal disease preparedness. Australia already has a very robust biosecurity system with structured disease surveillance programs and rigid disease response frameworks. And our geographic isolation from the rest of the world is a fortunate component that contributes to our disease-free status. But we can't just rely on this. The Commonwealth Government is responsible for biosecurity measures protecting our international borders, whilst the state and territory governments govern our domestic biosecurity systems. An integral part of our strong nationwide biosecurity structure is individual property biosecurity planning, to which the responsibility falls to individual property owners. Having a biosecurity plan for your property is one way you can help protect yourself and your wider industry from the impacts of an EAD incursion. So farmbiosecurity.com is a really good resource I would recommend having a look at. It goes into some details of things you should consider when creating your own biosecurity property management plan, and we can discuss some of those now. So a farm biosecurity management plan is a property-specific document that helps to identify and prioritise the implementation of biosecurity practices relevant to your property. A good plan not only helps to reduce biosecurity risks, but it considers contingency measures that will help protect your property in the event of an EAD incursion. To develop a comprehensive plan, it's important to consider the following biosecurity essentials. So farm inputs, account for anything moved onto your property, even temporarily, including from trusted resources with which you may have long-standing relationships. So these can be potential sources of disease, and strict guidelines should be developed in accordance to the risk profile of that specific input. So common inputs include animals, feed, and water sources. And so when we think about animals, managing the introduction of new and returning stock is integral to good farm biosecurity practices. All animal movements must be recorded for traceability, and animals should be quarantined in an isolation paddock out of contact from all other stock. Sharing of breeder bulls between properties without health screening and quarantine measures is an example of poor biosecurity measures. So farm outputs is anything moved off your property, and that is a potential biosecurity risk for the wider industry. Animals should be free of disease and fit for travelling and have a national vendor declaration. It's important to note that this also applies for animal movements between different properties under the same ownership. People, vehicles and equipment are high biosecurity risks as they move on and off properties frequently and may come in close contact with animals. They're potential sources of spread for diseases such as foot and mouth disease. So control measures should be maintained to limit property access and contact with high-risk property areas. Compulsory hygiene practices supported by signage and the necessary infrastructure can also help reduce the risk of disease spread. And regular equipment cleaning and disinfection protocols should be incorporated into core work. Restrict vehicle access from unknown persons with appropriate boundary fences and effective signage to ensure any visitors enter and exit via a regulated access point. So production practices, incorporating good biosecurity behaviours into everyday farm management helps to reduce the risks of disease spread whilst embedding these practices into how you operate. There's an old saying which I really like, is that there's no greater fertiliser than a farmer's footsteps, and that signifies the importance of having a physical presence throughout your farm. This is particularly relevant in the modern era of technology. Regular monitoring of your livestock health status is important for early detection and reporting of disease. Vaccination and preventative health treatments relevant to your location and production system can help protect your stock from preventable diseases. And maintaining your property boundary fences can prevent contact with neighbouring stock or feral cattle and buffalo to help reduce the risk of disease incursion. So on that note, when we think about ferals and weeds, contact with feral animals such as scrub cattle and wild buffalo are a potential source of disease, as we've discussed with foot and mouth disease and lumpy skin disease. Preventing or limiting access to your herd where feasible is important, as well as developing a wild animal control population program where appropriate. Then training, planning and recording, three very essential components of a biosecurity plan. Implementing and maintaining good biosecurity practices is not an individual effort. To ensure staff can operate in a biosecurity conscious manner, it's important to provide them with appropriate training and awareness. Incorporating regular training into work practices and educating staff on why biosecurity is important will help create a biosecurity conscious work culture. Staff need to know what to look for, how to detect and report disease, and the importance of early detection. Planning involves considering how you will operate in the event of an EAD incursion, even if not directly affected. Considering important aspects of how you operate and how to future-proof these if there's a sudden change to our industry. So for example, food supply and storage in the event of movement restrictions. Record keeping helps protect you and our industry. So detailed records should allow property owners to trace back and trace forward if there's a disease. And implementing a farm check-in procedure can help manage property attendance and inform visitors on the important biosecurity measures in place. This will help ensure any personnel entering and exit your property come clean and go clean and meet their general biosecurity obligation. So traceability is incredibly important when we think about an emergency animal disease response, and accurately recording livestock movements is critical to supporting the integrity of traceability in the event of an emergency animal disease outbreak. So as we previously discussed, in order to rapidly respond to an emergency animal disease such as foot and mouth disease, minimizing disease spread is crucial, and to do so we need to be able to accurately follow all cattle movements. So to support this, ensure all cattle movements are correctly recorded on the NLIS database and that the movement is correctly reflected in the movement record. So just remember, biosecurity is everybody's business. Everyone has a role to play in biosecurity, and our national system works best when we work together to protect our industry. It's important to remain alert and not alarmed. And if you're concerned about an emergency animal disease, please contact the EAD hotline.